There's new groundbreaking guidelines. They were just issued for the first time to help prevent strokes in women and focusing on pregnancy, birth control, migraine, headaches, and other risk factors unique to women. And here with the details, please welcome the co-director of the UCLA Stroke Center, neurosurgeon Dr. Neil Martin. Welcome, Doctor.
Well, thank you. So let's talk about the guidelines. Why were they? What are they? Why were they issued?
Well, one of the things we're trying to do in medicine now is be more precise with recommendations based on an individual's personal situation. And one of the most fundamental things is to consider gender. So women actually have more strokes than men. Really? There's almost 1 million a year. It's one of the top 3 causes of death, and it's the biggest cause of disability. So the key thing about these guidelines is that we're identifying the unique risk factors now and emphasizing them that women face.
What are they?
Well, the most fundamental one are the complications that can occur with pregnancy. There's a condition called eclampsia and preeclampsia, and this is a condition in pregnancy or in the early phases of pregnancy where blood pressure is increased. Mm-hmm. If that occurs in somebody who has the other risk factors for stroke, high cholesterol, cigarette smoking, diabetes, then that magnifies the risk of having a stroke both during the pregnancy, but even for many years after. Okay. So recognizing that preeclampsia is a unique risk factor is something that it's going to allow us, for those pregnant women who develop this condition, to monitor them very carefully
throughout their lifetime.
For really their entire life.
So what happens to these women? Because usually during menopause, you go up, your risk factor goes up as well. So does this double your chance if you have preeclampsia and then
Well, it doubles your chance of having a stroke, and it quadruples your chance of having high blood pressure later in life. So people who've had this condition have to have very careful follow-up with their personal doctor.
What about women who have a history of high blood pressure in their family? It just, through no fault of their own. I mean, they just have it because of their history.
Well, there are genetic factors involved, and that just emphasizes the need for those individuals to be monitored very carefully by their primary care doctor.
What should we be looking for when you have a stroke? First of all, what is a stroke, and what should we be looking for?
Well, stroke comes in 2 varieties. The first is an ischemic stroke. That's when a clot blocks a blood vessel and the brain is deprived of circulation, and brain cells start to die for lack of oxygen. The second kind is when a blood vessel weakens and ruptures, for instance with an aneurysm. That's called a hemorrhagic stroke. That's about 15% of the strokes. So the real key thing is that you're losing brain cells because of the impaired circulation. 2 million brain cells a minute.
Oh.
And so every minute counts, and one of the most critical things when a stroke occurs is that you get treatment immediately.
Well, do you get treatment? You say immediately. Most of them happen at home. It happens at home.
Right.
So how could you tell your significant other or the other people that are living in your house what to do in an emergency?
Yeah. Well, remember this memory aid, FAST: face, arm, speech, and time. So if you see drooping or asymmetry of the face or irregularity with smiling, that's a sign of weakness that's related to a stroke. If you ask the person to hold their arms up and one arm drifts down or they can't raise it, that's another sign of motor impairment related to a stroke. Those are key risk factors. If their speech is garbled or abnormal or they sound tremendously disoriented, then that can also be a critical sign of a stroke. When a stroke occurs, you've got 3 or 4 hours to get treatment, because in today's world, you know, there's been a revolution in stroke treatment. In today's world, if you get the right kind of medication in the first couple of hours, the symptoms of a stroke can be completely aborted. You can be returned completely to normal, and you can avoid the long-term neurological problems and handicap that goes along with a stroke.
Can we go back for just a second to the guidelines that we were talking about? Birth control pills were included with it. Where do they fall in this?
So birth control pills seem to have, through their hormonal effects, an effect on the clotting of the blood. So a variety of different blood clotting problems, from blood clots to the legs to clots that can cause a stroke, are increased somewhat. And here's really the key thing with stroke risk. If you've got other risk factors, high blood pressure, cigarette smoking, high cholesterol, then you have to be very, very careful with birth control pills and maybe choose another kind of contraception.
Did you have a question, Debbie?
Yeah, because that's saying to me, my generation, I always believed that strokes were something that older people get, but you're telling me birth control and women who are in their pregnancy years, that means young women are getting strokes.
Young women can get strokes, there's no question about it, but some of these factors also contribute to the long-lasting risks of a stroke later on. In fact, women who are over 45 on birth control pills are the group at the highest risk. So they have to be very careful with these other risk factors. If you're on birth control pills, you shouldn't be smoking. You've got to have your blood pressure watched very closely.
Can we go back to something, because I think as our audience is watching and they go, okay, what if I am suffering a stroke or having or experiencing or somebody I'm with? You talked about medication that's there and the timeliness of this. If you're living in a rural area, somebody, you mentioned smiling. I don't know if you try to ask them if you can smile. What kind of medicine are we talking? Is this something that I should have on my shelf at home?
You won't have it at home. This is clot busting medication. It's called TPA. It can only be given by a neurologist trained in stroke, because if you give it to somebody with a hemorrhagic stroke, a bleeding stroke, it's going to make the situation worse. It's only for an ischemic stroke, when there's a blood clot that can be dissolved to restore the circulation. So what do you do at home? You call 911. You don't waste 6 hours trying to get in touch with somebody else. You call 911, you get to the emergency department right away. They're going to evaluate you, manage your blood pressure, check your blood chemistry, get a CT scan of the brain, and then a decision is going to be made within those first couple of hours whether or not it's safe to give you TPA.
What about, you know, you hear these stories of these people that have a stroke and boom, they just fall down, and then there they are. What is that?
Well, you know, rupture of a brain aneurysm is one of the most devastating kinds of stroke, and that is like a vascular explosion inside your head, and 15% of people with a ruptured aneurysm die immediately. They're
I have
DOA.
to tell you, that's what I'm most frightened of, is that happening.
It's not the most common kind of stroke. It's something to be very concerned about if you've had a profoundly unusual headache. But the sign of a ruptured aneurysm is the worst headache of your life, or an extreme headache, usually on one side, and if it's accompanied by any neurologic symptoms like the fast symptoms, then you need to get into a hospital right away, because it's possible to treat an aneurysm and prevent some of the devastating consequences. We have many patients now that we treat neurosurgically who recover completely after a brain aneurysm rupture.
Okay. I was saying several months ago, I thought I was having a stroke. I ended up on the floor with extremely high blood pressure, and I remembered like having some symptoms, and I thought something is wrong, so I immediately took an aspirin, because I thought, okay, if I'm going to have a heart attack or if I'm going to have a stroke, this aspirin is going to help me. Now, I asked you that question during commercial. You told me the aspirin would probably help if I was having a heart attack but not a stroke.
Right.
Why?
If you're having a bleeding stroke, then aspirin interferes with the ability of the blood to clot, and it actually may perpetuate the bleeding.
Oh, okay.
If you're having a stroke related to a abnormal blood clotting, aspirin can be helpful, and it's helpful in heart attacks where it's always a problem of clotting or closure of blood vessels.
Well, I went to the emergency room right away, and it was only anxiety. I'm fine. Yeah, but thank God. I was
you
really
did the right thing. You went to the emergency department,
yeah, I did.
and so you gave yourself a chance to get the kind of treatment that's required.
Okay, great.
Wonderful.
Thank you. Thank you so much, Doctor. Thank
for
you.
being here. I know
Thank you.
Christina had a million questions.
Yeah, okay. For more information on Dr. Martin, you can go to neurosurgery.ucla.edu.
.edu.